Hello, everyone. I am Dr. Shruti Desai, Rheumatology Fellow from Chandray Hospital. We have a Patient Safety Awareness Week in the month of September. So in the context of this, we are going to be talking about certain safety measures that need to be taken in rheumatoid arthritis. So you can ask, why rheumatoid arthritis? Because rheumatoid arthritis is one of the conditions which is what we call a chronic illness, which means that it can stay for many years. And then this also requires long-term treatment. And this is one condition which can cause significant pain and swelling in your joints. And also on some occasion, if it is left untreated or because of the inadequate treatment, it can lead to deformity. So because of this constant pains and the deformities, this can impact daily life activities and also directly impact the life in itself. So with this, because this is a condition of a long-term illness and also requires a long-term treatment, there are a lot of safety measures that needs to be taken care of or addressed during its treatment. So what are the main areas of the safety measures that has to be taken in rheumatoid arthritis? So one is the managing the pain and the inflammation of the joints. So this actually forms the crux of the whole management of the rheumatoid arthritis. Because of course, we don't want you to be in pain. We want your joint inflammation to come down as much as possible. So that this management itself becomes the main cornerstone. And also some safety measures have to be taken during the treatment, managing the side effects of the medicines. And also these patients are more prone for infections, so we have to manage the infections. There are also certain measures that has to be taken to prevent osteoporosis, and also certain aspects on prevention of falls, especially in elderly patients. So if we take each area, so when you talk about the safety precautions in and around managing the joint pains and the inflammation. So what are the main areas how we can reduce the joint inflammation? One is, the very important one is taking your medicines regularly. So your doctor would have prescribed the medicines according to your clinical severity and based on a lot of clinical context. So we would have given you different dosage and the different combination. So being compliant with the medicine and taking these medicines become very, very important. And I'll also talk about the safety precautions around the medicines in my next slide. So apart from medicines, another important aspect of controlling the inflammation is the exercises. So the regular guided exercises. Why we say guided is because there are certain joints where you'll be having a lot of pain, a lot of inflammation. So there may be certain exercises that might be limited for you. So we always say that take the help of the physiotherapist, or sometimes even the occupational therapist who can assist with certain devices, who can guide you with exercises. We always say that you have to have a good warm-up before you start exercising. There are a lot of stretching exercises that can be done. And we also say that avoid high impact exercises, and especially the exercises which causes a lot of weight bearing on the joints that have been affected or the inflamed. So these are the precautions that need to be taken when you're exercising with the affected joints. And of course, the regular mobility, the more you move, the stiffness will come down. So we always encourage be as mobile as possible, go for walks, and be as mobile as possible to reduce the inflammation and the swelling. Next, as I said earlier, the safety around long-term medicines. So when we prescribe you medicines, especially we have given you various combinations of 2-3 medicines, and we say that the immunomodulating drugs. So people are always worried about the side effects. So I'm taking at such an young age for so many medicines. So whether it will impact my liver, whether it will impact my kidneys. And so as physicians, as a prescribing doctors, we are also concerned about the side effects. So how do we manage about these side effects? So what are the safety measures around these long-term medicines? One is the medicines compliance. So take the medicines as prescribed at the appropriate dose, at the appropriate timing. So if there are any missed doses by any chance, then if you realize it after a long time, then do not double dose it. So take the next dose, or always consult your doctor if you have any doubt about the medicines or the dosage itself, and do not get confused. So some medicines are weekly medicines, some medicines are daily medicines. So you have to be cautious about the timing of the medicines as well and take them accordingly. Some patients can develop allergic reactions to the medicines. So if that happens, so immediately stop the medicines. So allergic reactions in terms of if you have any skin rashes, skin itching. So you're advised to stop the medicines immediately and report to your physician. Sometimes some patients may not tolerate the drugs, so you might feel a lot of nausea, feel very sick when you take the medicines. So if that happens also, so please talk to your doctor. So we can always change the doses or alter the medicines as clinically indicated. Then the more serious side effects that we worry about is if it is causing any liver or the kidney toxicities. So what do we do to monitor these is that we call you for regular follow-ups, say for once in a month or once in 2 months, based on the doses and the clinical requirement. And at each follow-up, so we ask you for certain blood tests. So in the blood test, we monitor for any changes in your liver, and the changes in the kidneys, any changes in the cell count. So we look for any toxicities, and if it is only if it is safe and if there are no side effects, then we continue the medicines. So this is one way to make sure that yes, you are on long-term medicine, but yes, they're safely prescribed and they're monitored for any side effects. Then other important thing is do not stop or change your medicines abruptly. Somebody suddenly comes and tells you you're taking so many medicines. So don't change the doses or don't stop your medicines without consulting your doctor. And also sometimes once in a while you have severe pain, so you go to a physician or a pharmacy and they give you over-the-counter medicine or steroids. So again, do not start any new medicines without consulting your regular rheumatologist. And also do not combine any other form of medicines, like for example, homeopathy or Ayurvedic. So do not combine the other methods of treatment with your medicines. And another safety concern is during pregnancy planning. So a lot of our patients are young women who are in the in the time of their life where they're planning for pregnancies and marriage. So if this is happening, always discuss with your doctor, because certain medicines have to be avoided during pregnancy. Then another important aspect to manage in rheumatoid arthritis is that these patients, either one because of the uncontrolled inflammation or because of the immunomodulating drugs itself, they're slightly at an increased risk of infection compared to any other population. So in order to prevent the infections, there are a few things that you need to be kept in mind. One is maintain good hygiene at all the times. Avoid crowded place as much as possible. If you do go on a crowded place, always wear masks. Avoid eating uncooked food outside. So take a lot of precautions while traveling, using public toilets, and maintain a regular follow-up where we'll be looking for certain cells and white cell count. So all these parameters. So maintain these hygienic precautions and follow-up visits. But another important thing that needs to be considered during an infection. So in spite of all these measures, people are prone to get infections, especially the elderly population or in the patients who have uncontrolled diabetes, they do get infections. So if that happens, what to do? Again, seek medical help immediately, and based on the severity of your infection and based on the blood reports, we may ask for admission or treat with antibiotics as an OPD basis. And during an infection, some of the drugs may be advised to be stopped. Sometimes some additional tests that the investigation will ask for. And another important thing to be noted in the infection is because some people, especially the elderly population, and because they've been on these immunomodulating drugs, they may not exhibit the classical sign of infection. So when you say classical sign of infection, we expect them to have fever spikes. We expect them to have cough or any other urinary symptoms. But many a times we say that they just come in saying, I'm just feeling tired, or I'm not eating well, or the family members bring them saying, they've not been eating well for almost a week. So this might be a sign of infection, not necessarily they have fever. And most of the time we end up having one other infection, commonly urinary tract infection in ladies. Although again, they never say that I never have urinary symptoms. So these are the things that need to be kept in mind, that anything changes or any slight things where you're feeling unusually tired or you're not feeling like eating, again, come and get yourself tested, and we'll be looking for any signs of infection and managing accordingly. Then another important aspect to be considered is to prevent osteoporosis. The rheumatoid arthritis itself, it causes reduced bone density. This in further leads to osteoporosis. Some of the causes are, again, as I said, the disease itself, and sometimes long-term steroids may also worsen the bone loss. And the bone loss is much more predominant in people who are inactive or who are not physically very active. So what are some of the measures to prevent osteoporosis? So as I said, being active and incorporate regular exercises in your daily life. So that in large prevents bone loss to a large extent. Also avoid high impact exercises like a lot of aerobic exercises or other type of high impact exercises we advise you to avoid. Maintain a healthy, well balanced diet, incorporating a lot of micronutrients and macronutrients in your diet. So normally for all our arthritis patients, we would have prescribed calcium and vitamin D supplements. So make sure that you take them regularly to prevent the bone loss and to strengthen your bones. And also, if we do notice an osteoporosis is already set in, then we prescribe some medicines like bisphosphonates or certain injections, so that can be taken as advised. Then in elderly patients, so either one because of the deformities or because of the pain itself, they're at increased risk of falls. And on top of that, if they have osteoporosis, so this can lead to a fracture, which again significantly impacts their life. So in order to prevent falls, there are certain measures, again, of course, you have to keep in mind. So in case of if you have a lot of deformities or if you have a difficult mobility, then we have a lot of assisted devices and orthotics which can help you with your mobility. Use of walking frames or a stick would really help you in preventing falls. Also, when you using the stairs or when you're walking, always take the support of the railings or the wall or the furniture, so to steady yourself. Sometimes the balance training can help you prevent from falls. Clear your home from all the clutter and keep your surroundings clean so that you do not trip on them. Use the anti-slip mats in the bathrooms and have adequate lighting, especially when in the night you wake up and you would want to use the bathroom. So have the adequate lighting and be safe generally. Then, as I said, there are a lot of deformities that we need to be dealing with as well in the long term. So you can adapt. So the occupational therapist or the physiotherapist can advise on these devices. So we have different type of hand splints or the finger splints that can help you with the day-to activities. Like for example, opening the jars, you can use these help of the splints. If you want to open the door, then there are a lot of modifications that needs to be done to help you with these activities. And then if you have foot deformities, then you have foot splints, the toe separators, there are a lot of other assisted devices to help you get in and out of the bed, etc. So these assisted devices or the orthotics will help you with your, as I said, with your mobility and prevent you from having any untoward incidents. Another important aspect I had to stress on is in the pregnancy and the breastfeeding. As I earlier also mentioned, certain medicines are avoided in breastfeeding and in pregnancy as well. So when you're planning for this, always discuss with your doctor so that we can change your medicines, we can modify our medicines and let you have a safe pregnancy and breastfeeding. So in conclusion, what we would like to send the message is rheumatoid illness is a long-term illness with long-term implication, with a lot of implication to your daily activities. But if we take all these adequate precautions, necessary safety measures, and adhere to all the advice and the medicines that have been given to you, we can manage this condition with little impact on our lives. Thank you.